In order to characterize better the curvatures of the spine, we will remove the articulations of the spine column with other bony structures. So, from a lateral perspective, we can see that there are four curvatures, and starting with the cervical region that has lordosis, thoracic region is going to have kyphosis, and then the lumbar region, then it's going to have again lordosis, and the sacrococcygeal region with a kyphosis. So each one of these regions are going to have a different amount of degrees. Usually the cervical lordosis is going to be around 30 to 40 degrees. The thoracic kyphosis is going to be around 20 to 40 degrees. And the lumbar lordosis is going to be around 30 to 80 degrees. That is going to vary depending on gender and age.